My name is Gary Hooker. I'm a prostate cancer patient at Guy's Hospital in London. I was diagnosed with prostate cancer in January 2011. Spread to the bones and the lymph system, and stage 4, my PSA was 255 and I had a Gleason scale of 9 out of 10. Since that time I've had sepsis 3 times, I've had a mini stroke, I've been on clinical trials, I've had radiotherapy on my spine because of the metastases. I've got lymphedema, which caused some problems with my kidneys. I ended up with nephrostomy bags on my kidneys for several months. I have had a mild heart attack in the last couple of months due to having 2 lots of chemotherapy. I had docetaxel first and then found that the cancer had spread more and it's gone into my lungs. I've got a tumour on my aorta and more metastases on my ribs. And on top of that, I've got an ATM mutation. I'm not sure what that entails, but now I'm on a second course of chemotherapy, and that's cabazitaxel, and that's a stronger one, and I've just had 3 cycles and it could be 10. So I'm about to see how that happens. So I'm actually full of data for Prostate Pioneer. I could do a whole week on my own. But that wasn't the reason I got into Prostate Pioneer. We had a support meeting at Guy's Hospital and 2 young ladies turned up from Prostate Pioneer a few years ago, recruiting patients for a study-a-thon. And it was to introduce AI into prognosis and treatment plans. I was a certain age and didn't really trust computers to make diagnosis and treatment plans, so I thought I'll go on this because not on my watch is a computer telling me what's wrong with me. So I signed up and I went on the study-a-thon, and it was the most amazing, fascinating thing I have ever done. And the education I received, because I was totally naive about data collection, completely changed my view. And I could see on the outcome that it was the way forward. What surprised me the most on the study-a-thon was I thought I was there as a tick box, a patient on the study-a-thon, it's a good thing. But no, it was complete. They involved me in every discussion, decision making, policy making, and you felt like you was part of a massive team. And that's why I got involved, and I still try to stay as involved as I can. I have restrictions on sometimes when medications and my health, but on the whole, I think they're doing a wonderful job and I want to stay part of it. When I was diagnosed, the registrar came in. I was in Guy's Hospital at the time, and he said, "Oh, Mr. Hooker, we've got the results back. It is prostate cancer. It has gone to the bones and your lymph system. There's not a lot we can do. Someone will speak to you in the morning," and turned around and walked out. So that was my introduction to having cancer. I had no symptoms or anything. I only found out because I went into hospital with a chest infection that turned into pleurisy. They did an X-ray on my lung, which found shadows, and they did a CT scan, which they said it's nodules, we think that's secondary. And that resulted in finding out about the prostate cancer. With Pioneer, it's given me an outlet to give something back, because I was very naive about technical stuff and computers and data. And I started to get involved because patients on my support groups were asking questions on data protection and everything. They said, "Oh, if they want our information, How do we know we're protected and everything? So I had to go around lots of groups and reassure them that there was, things in place, that it doesn't go into anything else, and it doesn't even use your name. It's just the data collection from patients. So in the end, they all sort of agreed, and that started me on the sort of path of data collection, and going on Studyathon showed me what they did with that data and how, I don't know how, but they analyse it and they get it to make apps which at the end of the day are going to be so useful for consultants, clinicians and patients at the end of the day. It was actually very refreshing, because patients have always tried to have a voice, and I've been the patient representative at Guy's Hospital for many years because of the successful treatments I've had at Guy's, which is why I'm still here now. They've asked me to go on research projects and other projects to talk to other people, and I've got more and more involved. And the Studyathon that I went on with Pioneer just showed me how important it is to be able to collect the data so widely that when it comes in, I always had the opinion it was going to be a general thing and it doesn't take in the individuality of patients. But I was wrong. It was going to be, it's a tool, not a set thing. So it's to help consultants and clinicians to make the right decisions. And that's why I got involved, and I'm really happy being involved. Well, it's quite obviously the way forward for the future. Consultants and clinicians that haven't got the time to analyse every patient that gets diagnosed with cancer. This is going to be not a shortcut, but it's going to be the first steps taken out of the way, because it'll give all the information at a touch of a button. Whereas if you have to read files and files and get results, it can take ages, and then you're not getting the proper care and possibly not the proper treatments for each individual patient. And that is the most important thing. I'd like to thank Prostate Pioneer for at first coming and introducing me to themselves, and then giving me the education and the platform where, as a patient, we feel respected and used in the right way.